to Health in Your Hands, the program that equips you with loaded information to better health living. In Health in Your Hands today, we'll be going further. It's like these days we'll be talking more about things that affect the women. Today we'll be focusing on ectopic pregnancy. Some of you might be wondering what's ectopic pregnancy. Just sit back and you get to unveil what it is all about. With me is our doctor, a friend of the house, because he's been here before, and when he came, he did justice to the topic he came for, and today I'm sure he will do more. He's no other person than Dr. Dele Ogunfowokan, a consultant family physician and the medical director, the ARC Medical Center, Asaba. Sir, it's good to have you again today.
Thank you very much.
You're welcome, sir.
Yeah.
What are the signs and symptoms of ectopic pregnancy?
Okay, thank you very much. So when we're talking about pregnancy, what we know about that is that there is the female and the male factor to it. The female produces the egg and the male produces the sperm. And when the two of them comes together, it forms pregnancy. That's actually pregnancy. And most of the time, before the woman gets to know that she's pregnant, the pregnancy has already occurred. Except for those people that do IVF, where they can know the date that the embryo is transferred into them. But for the natural one, the pregnancy will have occurred before the woman will, because the woman will get to know that she's pregnant when she misses her period. And it's at that I say, I didn't see my period. So what is going on? Okay, let me go and do a pregnancy test. And then they do the pregnancy test, they said it's positive. And then they say, okay, I am pregnant. If the person is married, she'll be happy. But if the person is not married, then he will be filled with sorrow. I say, okay, what will I do now? I want to remove it. I want to do that. And then be moving from one point to the other to get rid of that pregnancy. So that is what pregnancy is all about. And for you to know for you to know what is ectopic pregnancy,
Yes.
you have to know what is the normal pregnancy.
Mm-hmm.
So because ectopic pregnancy is telling that the pregnancy is staying in the abnormal place. Mm-hmm. And if you look at the female genital organ, you have the womb, and in the womb you have the fallopian tubes, you have the ovaries, and then so the pregnancy actually occurs in the tube. After the man and the woman must have met, the man deposits the sperm inside the woman. The sperm swims into the womb to get to the fallopian tube. And the egg also is released. The egg also enters into the fallopian tube. And at one point in the fallopian tube, the two of them meet and they form an embryo, which is a baby. And then that baby from that fallopian tube now moves down and settles down in the inside the body, inside the womb. And then it starts growing from there. And the way God has made it, God has made that womb, though very small initially, by the time baby is implanted there, he has the ability to grow so big to contain a human being. And as soon as the baby is out of that womb, the womb starts coming back again and comes back to the normal size. That may not be as big as my fist is too big for the size of a non-pregnant woman, uterus. And something that is about half of this my fist, for instance, we now have to take a whole human being. So that's the process of pregnancy. And then when you're not talking about ectopic, you're not talking that that pregnancy does not stay inside the womb. It stays in the appendage of the womb. Because most of the cases, about a greater percentage of it, the time that the pregnancy occurs in the tube and they are coming down to come and settle down inside the womb, they get arrested.
By what?
They just stay, they couldn't just go. Maybe the person have problem with the tube before, and we'll come to that later.
Okay.
And that baby is not able to go down over there. The baby keep on growing. And because the tubes are not meant to carry that kind of load and carry that kind of size of baby, then you have, that's where the problem comes from. So ectopic pregnancy is actually a pregnancy that occur and start and continue to develop in an abnormal place. And that abnormal place, like what I've told us about how the pregnancy occur, how it happens, the most likely place it can occur is in the tube, in that process of coming down. And then sometimes some other location of ectopic could be in the ovary. As the egg is releasing from the ovary, before it gets inside its vessel and coming around, the sperm has gone there to meet the egg. And then you have what they call ovarian pregnancy, which is also possible. And sometimes the pregnancy could occur there. Instead of it coming down to stay inside the womb, it could actually go in the other direction and stay inside the abdomen. You have abdominal pregnancy. And then, while the embryo is coming, when it gets to the tube, the inside of the womb, and for it to stay there and get implanted, it moves out of that place and comes to the cervical part of the womb, because the womb has the body, it has the neck, so the neck is called the cervix. So it can come around there and get implanted. And any other place that the pregnancy is implanted that is not inside the body of the womb, which is called the body of the womb, any part like that is referred to as ectopic pregnancy. And sometimes you could have a twin pregnancy, and then one of them will settle inside the normal place, and the other will settle other place. So in that kind of thing, though you have an ectopic component of it, you have the normal component of it, and in that case you have what they call heterotrophic pregnancy. And then that has to be diagnosed early and taken care of. And if it is well taken care of by specialists, by people that know what they ought to do, you could actually save the life of the one inside the womb, while the other person, because once you have ectopic pregnancy, you are not likely going to be able to save that baby's life. Each baby has to go. So
ectopic pregnancy is dangerous, to the embryo, that's the baby itself, because you can't be able to save the baby's life.
Yes, it is. It's dangerous to the baby, and it's dangerous to the mother. Dangerous to the baby in the sense that the rate at which the baby grows very, very fast. And for you to be able to cope with that growth, you need something to support the baby to grow. And that's why you have, the baby has to be inside the womb, where all the nutrients and all the things that baby will need will be supplied. And then as baby is growing and is expanding, the womb also is expanding.
Yes.
And then the blood supply to the womb is also increased. And then the nutrients and everything is also increased to the baby. But when it's growing in other places, it gets to a point that the growth of the baby is so great and faster than that place that baby is. The value, the nutritive value to the baby will reduce. And if it's in the tube, for instance, the tube can burst. And as it bursts, then the woman starts bleeding inside the abdomen. And then the baby too, the baby's nutrition also is compromised. So the baby has its own complication, and most of the time the baby dies. And then the woman also has her own complication, because the woman kept on bleeding. And the bleeding is not arrested. And if the bleeding is not arrested, it can bleed all her blood inside her tummy, and nobody will know, except towards the latter end of the process, that the woman will just collapse or something will happen and then the woman is gone.
At what point, will the woman now seek medical attention in this case?
Well, usually, if there's ectopic pregnancy, it's difficult to diagnose. But there are some telltale signs that you see.
Okay.
Then, number one, the woman must have missed her period.
Okay.
That's the basic thing. And then, maybe I will use that opportunity to discourage people from registering for antenatal very late. Because if you register late for that, okay, when my pregnancy is 3 months, 4 months, that's when I'm going to register. Ectopic will have occurred that time, will have done the damage even before that time. Talking about when to register, I think as soon as pregnancies are established, the woman should register, and then the doctor can take it on from there.
Okay. So, sir, what could be the causes of ectopic pregnancies?
Well, the causes of ectopic pregnancy, like I said, is when you have pregnancy in an abnormal position. That is, it's not inside the womb. Well, if somebody has an ectopic pregnancy before, it's likely that the patient can still have ectopic pregnancy again.
What if the person had not had it and it now has it now?
Yes.
What could have been the cause?
That's what I'm saying now. That's one. Then the other thing could be what they call tuber factor. And like I told you in the introductory part of it, the pregnancy actually occurs within the tubes. And if the tubes are diseased, then that movement, that smooth movement from where the pregnancy occurs to the time the pregnancy gets into the womb can be obstructed, or can slow down the movement, and the baby will just settle down where he finds himself. So to that factor, like maybe you have people that have genital infection before, STI, PID, and then they have problem with their tubes, that could be a factor. And then maybe there have been some kind of surgery on the tube before, for one reason or the other. Maybe we are evaluating this person for infertility, and then the process you need to work on the tube, and so that could also be a factor. And then sometimes when you have multiple ovulation, and then one is going the other direction, you could have that. And then sometimes a woman that has fibroid could also be that, because by the time the baby is coming down, if the fibroid is at the corner, that is the junction of the tube and the body of the uterus, then it could be so. The fibroid could actually prevent that embryo from passing through that place and getting to the uterus, and then you have an issue with it. So there may be a lot of things like that could cause it, but it happens.
Well, you heard it. A lot of things will cause ectopic pregnancy, and it could happen. That is the reason why you should stay tuned to Health in Your Hands. We're quickly going on a short break. When we return, the discussion continues.
Oh yes, do you have any health challenge, or are you looking for a medical expert to give you answers to those health problems? Search no further. Keep a date with us every Monday at 12:30 p.m. on NTA Asaba for Health in Your Hands, a health program where medical experts x-ray various health topics that will change your health for the better. Join us Mondays 12:30 p.m. Health in Your Hands, good health is wealth. Don't miss it.
Welcome back to Health in Your Hands. That is reaching you from NTA Asaba, adding value to society. If you missed the first half of this program, quickly go to our social media handle on NTA Asaba Live, Facebook and YouTube. You get to get all the informations you need on ectopic pregnancy. But before then, just sit back so that you can also get this part of it firsthand. So now I want to ask, how can ectopic pregnancy be diagnosed?
Well, the diagnosis is one, you establish that the person is pregnant. And that could be done by doing an early pregnancy test, which should be positive. And then, if the complication has not set in, you may not know much more than that. Then you can do an ultrasound. But at the early pregnancy, maybe not everyone will be able to pick it at that time. You may need a radiologist to help you with that. And then when you are doing it too, you may not be able to get it from abdominal ultrasound. You may have to do a TVS, transvaginal ultrasound, to be able to pick it. And then when that is established, if you are able to pick it up on ultrasound, it can show you that okay, the uterus, the inside of the uterus is empty. And then you have the pregnancy in the agnesia. The agnesia means that the structures that are around the uterus. So you can be able to pick it up that way. But sometimes you may also pick it up when the complication has started. And the complication that the patient will present with pain in the tummy. I say, well, I have this lower abdominal pain. And the patient may spot, and they'll be spotting of blood. And the patient may say, maybe this pregnancy wants to come out, or whatever. But the pain will be there. And most of the time, the pain precedes the bleeding. Because what will actually cause the pain is when that tube or wherever is ruptured. So that rupturing and the blood coming into the abdomen elicits pain by the time it gets in contact with the covering of the abdomen, which is called the peritoneum. So the patient has pain. He has this slight bleeding, and then that may be the thing that will bring the patient to the hospital. And then when the patient comes to the hospital, the doctor will say, when did you see your last period? And then it will tell you, maybe by the time you extrapolate, maybe about 6-8 weeks, highest 10 weeks from the last menstrual period. And then you examine the patient, you will be able to demonstrate that there's pain in the abdomen. Then at that point in time, you could also do some tests right there. And then that will depend on how much of the blood has accumulated in the abdomen. If the blood is so small, you may not be able to do that. It will stick it a needle to see whether there's blood inside or not. And there's other standard procedure after getting the blood, because it's not every blood that you bring out from the abdomen that is from ectopic. But when you bring out the blood, the doctors know what to do to be able to differentiate it from getting the blood from the vessels and the one that is in the peritoneal cavity, which is as a result of the ruptured ectopic. But the thing that gives it out is ultrasound. And then with that, the treatment, whether you diagnose it clinically or radiologically through the ultrasound, the treatment will be enough for you.
So what kind of treatment follows after it has been diagnosed?
Well, it also depends on the stage you are picking it up. There are treatment modalities. If you are picking it up early enough before the rupture, then you can have what they call intralesional injection. That is, you go there under ultrasound guide to inject on that area where the ectopic is, and then that kills the baby, and everything is okay, and the woman is okay. But the one that presents most of the time, the one that presents to us most of the time is the one that has ruptured already. And the one that are going to give injection to is not automatic, but you need to be able to follow up that patient and be sure that everything is going on. Because even with the injection, the patient may not still be okay, so you may still need to operate and further. So most of the cases that present to us, they present when the thing has already ruptured and you need to operate. And when you operate, what you do is to remove the ectopic, because the baby will have been extruded into the abdomen. and then at the time of the surgery, what you do then is to go there and stop the bleeding for the woman to be alive. And the blood that is already in the peritoneal cavity, in the abdominal cavity, you remove those ones. And the baby that is already extruded there, you also remove it. So the baby, by the time the ectopic ruptures, and the baby doesn't have any supply of nutrients again, so the baby eventually will have died before you got in there. The embryo rather, because the embryo at that time. So, but at that time too, you want the baby, the mother, to be alive. And then the other part to it, why it's also good to have an ultrasound guide, is that you may have an ectopic pregnancy coexisting with a normal pregnancy. And I had that one some time ago last year. And what we did is to operate on the woman and save the life of the woman first. And then see how we can preserve the one that's in the normal place. And to the glory of God, at least, we're able to save the woman that time. And the bleeding stops. The one that extruded was taken away. And the one that was there, by the grace of God, God help us, we nurture that baby to term, and the woman delivered. So, but if you are not aware that there's one inside the womb, then during the surgery and the manipulation of the womb on that, you may actually be somebody, you may be the one that will make the other one to miscarry.
So there's so much on this ectopic pregnancy, and our time is fast spent. But I'll just, before we go, I want you, how does an ectopic pregnancy, affect future fertility?
Well, it's two-edged sword. I call it two-edged sword because, like when we are talking, we said that the pregnancy takes place in the tube. If one of the tube was bad before the ectopic, and the good tube is where you have the ectopic, once you have the ectopic operation, that tube is gone. You can't be pregnant through that tube again. So if unfortunately the second tube is not healthy enough to allow pregnancy to take place, that means that after the ectopic pregnancy, the woman can no longer get pregnant in the natural way. That is, man and woman coming together to form a baby. But the woman can still get pregnant through IVF. Because IVF will bypass the tubes. The baby is formed outside, and you transfer the embryo into the womb, and then the baby continues to grow from there. So, but if in the other side, the other side of the thing is that if the other tube is okay, and he had an ectopic here, and the tube of this one has gone, even without one tube, if you want to have 10 children, it's possible to have it. So it's neither here or there. It depends on what is the position and how healthy the second tube is, and how much money do you have in your pocket if the other tube is bad to do an IVF.
Thank you so much, Dr. Dele Ogun, for working for this light on ectopic pregnancy. Well, some other time, if we can get hold of our doctor, he will come so that we'll do the part 2 of this, because I know that you just want to get more of it. This is where we'll call it a day on health in your hands. Remember, health is wealth. Keep staying healthy to remain wealthy. See you same time next week. Bye.